Throughout my entire medical study, I was interested in naturopathic medicine and holistic medicine. I feel attracted to work with other people and to contribute to other people's well-being. I decided to study medicine, and this interest in life sciences and the science of vitality stayed throughout my entire medical study. But it didn't get well nourished from the official medical training I received at the med school. I found out very soon that the way medical doctors are trained today, that was the case already 35 years ago when I was at med school, followed a reductionistic and materialistic paradigm. Many qualities were not discussed that definitely belong to the phenomenon of life. And that is the downside of Western world medicine, that it treats diseases with blockers and doesn't look for the causes and has no solid understanding or concept of vitality and what is needed to keep a vital body alive. Nutrition was never a topic in 6.5 years training at med school, and it's still that way. That's what I hear from younger colleagues, that nutritional medicine or very simple basic things for us living beings like detoxification. How do we keep our vitality up by getting rid of the garbage that we produce or are exposed to, is nothing a medical doctor learns at med school. My mother developed breast cancer while I was at med school, and I witnessed her treatments and her progression during 4.5 years. It was very sad to see how she eventually developed liver metastasis and how the regular treatment totally failed until the day she died in June 1992 from liver metastasis and liver failure at the age of 54. That was a turning point in my life to see how my academic teachers totally failed to help her to recover from breast cancer. In the beginning was a lump of 2 centimeters. She definitely had a chance to get healed from that ailment. But the opposite became true, and she died at an age younger than I am today. That sharpened my focus at the various diseases called cancer, and I decided to work in that field to find possibilities and treatment approaches that help others in her situation to go a different road and to overcome the disease.
And I do think this is where modern medicine falls down. It's very mechanistic. It thinks of the body just as physical lumps of biological material, but doesn't really embrace the holistic nature of the body. And I'm not going to point the finger at doctors because I think it's their training is faulty. I think for the most part, doctors are good people. They've got a good heart. They went into medicine for the right intentions to help humanity, to help people. But then they're being trained in what some people call Rockefeller medicine. I don't think doctors can be blamed for it. I've noticed there are more and more doctors who are starting to become a little bit integrative, where they're still adhering to protocols because they don't want to lose their registration. We've got more and more doctors, GPs particularly here, who are embracing nutrition, obviously diet. My GP, I think he was a good chap, and he said, some of the things you've done, I don't really understand. Because I talked about Laetrile as well, which are in apricot kernels. By that stage, I was consuming them. This is 2 months into my recovery, and I could tell they were having an effect. And he said, yes, heard about that from other patients. I don't know much about it, and I'm not allowed to prescribe it. It could risk my continuation as a doctor. He said, listen, if it's working, keep doing it. I endorse anything that puts you on the path to recovery. And if you're feeling better, he said, I think that is a good gauge of your recovery. So there's an old saying, the definition of stupidity is to keep doing the same thing even when it's not working. And it's either stupidity or probably more like greed. I think we have the cure. And I think they're in a sort of a catch-22 situation, perhaps, where the income is very attractive and they've got families to feed and mortgages to pay and the rest of it.
Just kill people with their words. You take hope away. I know one man, and I got the family to sue the insurance company. He had cancer, but he developed cataracts. So his life became meaningless. He can't see a damn thing. The insurance company said, we're not paying for cataracts. He'll be dead in a few months. They're on a waste of money. He literally went into bed the day he got that letter and was dead in 5 days. And I told the family, sue the insurance company. And they did, because those words killed him. They took his life away. So I've learned, live your authentic life. Now we have a lot of studies. One college student, his professor thought he was nuts, but he's not nuts. He studied actors by giving them comedies and tragedies to act in. And he drew their blood while they were acting. And he showed the difference. If you're in a comedy, immune function is enhanced, all the benefits. And if you're in a tragedy, the opposite happens, and you're more likely to get sick, have your heart attack, cancer, whatever. Those are things people have to understand. What we're talking about has a lot to do with feelings, but the feelings are science. It's the pain. I cared about people. I became a doctor because I liked people, and nobody taught me how to deal with people. It was all about disease. I would say to patients, how come you didn't die when you were supposed to? And I realized that everybody had a story. It could be, I got a door, I changed where I lived, I changed my job. Everybody had a story to tell me. One multimillionaire, he introduced me at a speech down in Miami. I said to him, "You dressed like a bum. How could you come like this to, introduce me in front of this crowd?" He said, "When they tell you you're going to be dead in a short time, who cares what you wear?" I canceled the dress code at work. I told my employees, come in whatever you want. Don't worry about it. And then his wife got him to buy a house on the ocean and listen to meditation tapes. And he lived for over 5 years when he was supposed to be dead in a couple of months. And he really changed his hospital because they knew damn well it was him, not anything they were doing.
It started out by a bit of an accident. I took a job on the Big Island as a plantation doctor. And there I worked as a general doctor for 3 years. I caught babies, I pronounced people dead, I did brain surgery in the middle of the night. But I learned everything that I know today during those 3 years from my patients. First thing I learned is that I wasn't a very good doctor. I thought I was going to make all these miraculous cures. I mean, I watched Ben Casey, Dr. Kildare, Marcus Welby. I knew what a real doctor did. I went into this general practice on the Big Island of Hawaii, and I started taking care of these 5,000 sugar plantation patients. And I gave them the best pills I could find, sent them off to the best surgeons in Honolulu, and they wouldn't get well. They just stayed fat and sick. I thought it was because I was a bad doctor. I realized my limitations as a physician during those 3 years. I was humbled. I learned how to eat because I was taking care of 5,000 people who ate differently. I was taking care of first, second, third, and fourth generation Filipinos, Japanese, Chinese, and Koreans. Now, my first generation, they learned how to eat when they were little kids in their native land of the Philippines, Japan, China, Korea. They learned a diet of rice and vegetables. And then they had the fortune of moving to the Big Island to start new families, a new life. They took their original diet and they continued to eat rice and vegetables. The kids who were influenced a little bit by the Western diet, they started to change. And by the time you got to the grandkids, you were looking at people who ate the traditional Western diet. Now, realize these are people of the same genetics, same kind of work for over 100 years on the sugar plantation. Yet before my eyes as a doctor, I saw people living on rice and vegetables, no dairy, just a little bit of meat at most, trim, healthy, hearty people, no MS, no arthritis, no diabetes, no heart disease in that first generation living on those traditional diets. And then I watched the second generation get a little fatter and sicker as they abandoned starch. And then the third generation, which feared starch, rice, corn, potatoes, and took on meat and dairy in their diet and oils, they got fat and sick just like every other American. After 3 years, I had to leave as a general practitioner. I spent the next 2 years studying in the scientific library, in the medical library, next to Queens Medical Center, to see whether anybody else had made this observation, that people who live on starch, rice, corn, potatoes, sweet potatoes, are thin, healthy, hearty, young-looking, not just in the world today, but throughout history. That was important because that told me right there and then that getting older didn't mean getting fat and sick. It didn't have to be that way. But as I read in the science, I discovered something else that was profound, and I'm sure it's going to be easy for you to understand. When you stop doing things that make people sick, they get well. If I had figured out that eating a well-balanced diet with lots of meat and dairy made people sick, then the only next clue I needed was the idea that I could be a miracle doctor. I could fulfill what I wanted to do as a physician, which is to help other people by applying this very simple principle, and that is to feed people a diet for human beings.
The big deception of science-based medicine or evidence-based medicine is that it is based on all of the evidence, but it's not. It's only based on science and evidence that lead to patented billion-dollar drugs. That is how the industry has been built. I went to a gastroenterologist. He did a colonoscopy. And when I woke up after that procedure, he comes in, he said, look, you've got a golf ball sized tumor in your colon. He said, look, you've got this tumor and it might be cancerous. We took a biopsy. We were going to send it to the lab and see if it's cancer or not. A day or so later, I got a call and they said, listen, it is colon cancer. We go back to see the oncologist and he gives me the boilerplate pitch. He's like, got my file open. Look, 26 years old. You have stage 3C colon cancer. It's very aggressive in young adults. You're going to need chemotherapy, 5-FU plus leucovorin, and you've got about a 60% chance of living 5 years with treatment. Now, I didn't know anything back then. And had I known things, I would have asked a lot more questions. But I asked a couple questions and that shifted the tone of the conversation, and it ended up going in a direction that I did not expect at all. So the first thing I said was, what about the raw food diet? Because I'd been on it for 1 week. And he said, no, you can't do that. It'll fight the chemo. I didn't ask him why. I learned later that they were afraid that raw food is dangerous when taking chemotherapy because chemotherapy decimates your immune system to become very vulnerable to otherwise harmless bacteria on an apple. The other thing he said to me that I thought was weird, that changed the conversation, is I said, well, are there any alternative therapies available? And he said, no, there are none. If you don't do chemotherapy, you're insane. And from there, the conversation just turned into him berating me with reasons I had to do chemo. And the main one was, if you don't do it, you're going to die. He's talking down to me. He's telling me all these reasons I got to do chemo. And I wasn't even hearing what he was saying. I just wanted to run out of there. But one thing he said that jumped out was, he said, look, I'm not telling you this because I need your business. Which was like, wait, what? I was in sales and they taught me a technique in sales called the push away. And this guy just did the push away on me. Wait, what? What does business have to do with it? I didn't even think about business. I thought this was like healthcare. I wasn't thinking about it like a business. It's a huge part. And most of us view the medical industry as this sort of altruistic profession of selfless angels. And there's a lot of wonderful people in there, but it's a screwed up industry that screws up people in it. The point is everyone is conformed. It's like going to the military. You have to conform and become this thing that we make you into. And they jam medical students and doctors like into this box of conformity. But the interesting and kind of crazy thing is that the medical profession has the highest rate of suicide of any profession because it's so mentally, emotionally, and physically difficult to be a doctor. My appointment with the oncologist concluded, and I got up and walked straight out of that office into the lobby to the desk like a robot and made an appointment to get a port put in to start chemo. I had just been programmed, like manipulated with fear. And my wife and I walked out to her car, sat in her car, and just held hands and cried. And I choked out a prayer, and it was just, my faith was shattered. My confidence was gone. I was just terrified. And the reality is that cancer clinics, many of them are fear factories. There's so much fear in there, and they use fear to manipulate people to say yes to treatment. And cancer patients, more often than not, are making fear-based decisions, not fact-based decisions, and not faith-based decisions. They're just making a decision out of fear, which is, I don't want to die. I'll do whatever you say. A lot of cancer patients, they have got them in chemo within a day or two, right? Because they flip-flopped. Now they like to do chemo before surgery. Patients are just rushed in, man. They don't know what's happening to them. No idea.
Our drugs kill around 200,000 people in America every year, and half of these people die while they do what their doctors told them. They die because of the side effects. The other half die because of errors. It's often the doctors that make the errors because any drug may come with 20, 30 or 40 warnings, contraindications, precautions, and so on. No doctor in the world knows about all this. They give patients drugs that they should not have given them, that interact dangerously with other drugs or food items, and then the patients die. That's the other half. I found out 2 years ago that much of what the drug industry does fulfills the criteria for organized crime in US law. They behave in many ways like the mafia does. They corrupt everyone they can corrupt. They have bought every type of person, even including ministers of health in some countries. There is a huge amount of corruption. For example, in my country, Denmark, we are regarded as having very little corruption. But yet we have thousands of doctors on industry payroll, although we are just 20,000 doctors. This is an effective kind of corruption. The drug industry buys the professors first, then chiefs of department, then other chief physicians. They don't buy junior doctors. When several thousands are on industry payroll, it's really, really bad. And that's why I wrote my book, Deadly Medicines and Organized Crime, How Big Pharma Has Corrupted Healthcare. I hope to convince patients not to take so many drugs because so many die from the drugs they take. In my country, people take so many drugs that every single citizen can be in treatment with 1.5 drugs from they are born till they die. This is incredible. And drugs are not that helpful. They kill many of us. We know that. That's why drugs are the third major killer after heart disease and cancer.